Most people have experienced stress at one point or another, but did you know it can build up and have the same effect on your body as a heart attack? It's known as Takotsubo, and while it's rare, doctors say it's reason enough to make stress relief a priority. Back in 2015, Patricia Inns had a lot on her plate.
And I knew I was under a lot of stress and I wasn't handling it real well.
She'd been diagnosed with cancer, and life in general was just hard.
I didn't really realize it could cause so many problems.
She ended up needing to have a kidney removed. She went in for surgery at Clovis Community Medical Center.
My husband had just been told I was fine, I would be there for a while, go have a cup of coffee, and he had just gotten to the cafeteria and he heard Code Blue called.
After the surgery, about 2-3 hours later, we could not take the breathing tube out because her lungs were full of water. And the electrocardiogram, which looked okay before the surgery, after the surgery showed that she was having a big heart attack.
Dr. Rohit Sundrani, an interventional cardiologist, went right to work.
So we don't even actually wait for labs. We don't even see what the patient's looking like. We just bring them to the operating suite, the cath lab, and try to go open up the blood vessel.
He says his first thought was to open up the left anterior descending artery, which is typically fully blocked during a heart attack. However, Pat's wasn't. Dr. Sundrani says that's the first clue that this type of heart attack is what's known as Takotsubo, also known as broken heart syndrome. It's rare, happens in only about 2% of cases, but it can be fatal and needs immediate attention.
The first 2 to 3 days are very crucial. It's usually ICU stay in 2-3 days, and then the heart starts recovering.
Dr. Sundrani says Pat's physical stress from the surgery is what caused her heart attack. Emotional stress also plays a role.
I have tried to de-stress my life and enjoy every day. I feel like every day is a gift now. It could have been taken away from me. And I have learned that the small stuff just doesn't, the things that nag at people, that make them mad or stressful, really aren't important.
Patricia's heart has made a full recovery. She says she is grateful and focuses every day on living life stress-free.
I thanked him for saving my life, and that's how I felt. But he said, no, it wasn't me. It was somebody bigger than me.
Dr. Sundrani says a majority of patients are women, and it's most common for people in their 60s. The main symptoms of Takotsubo syndrome include crushing chest pain and shortness of breath. If you experience these symptoms, call 911.